Infectious disease. Antimicrobial resistance. This is when microbes resist the effects of medications and/or treatments. The germs are not killed and the growth is not stopped. It is very difficult to treat and anyone is susceptible. Some must be more cautious, such as those with weakened immune systems, open skin wounds, recent surgeries, and invasive procedures such as PICC lines, IVs, indwelling catheters, and etc. Antimicrobial resistance occurs worldwide and is an ongoing battle within institutions such as hospitals and clinics. Common antibiotic-resistant infections are MRSA, VRE, VRSA, TB, and C. diff. The combination of influenza and pneumonia is currently the 8th leading cause of death in the United States. More people die from it than from kidney disease or suicide. Influenza viruses spread from person to person via large particle respiratory droplet transmission. This requires close contact between the source and the recipient persons. Contact with respiratory droplet contaminated surfaces, and airborne transmission by small particle residue of evaporated droplets. Influenza viruses' typical incubation period is 1 to 4 days, with an average of 2 days. The contagiousness begins the day before symptoms start and lasts 5 to 10 days. Children may be contagious several days before becoming symptomatic, lasting 10 or more days after onset. Severely immunocompromised persons can shed virus for weeks or months. The influenza vaccine is 60% effective and varies with the vaccine and flu strain. It is selected based on the forecast from the CDC, and the seasonal flu vaccine is usually trivalent, which is a 3-component. Each component is selected to protect one of the 3 main flu viruses. Sepsis and septic shock. This is the body's response to infection, which is life-threatening, causing tissue damage and organ failure. Septic shock is when sepsis with refractory hypotension or signs of hypoperfusion despite adequate fluid resuscitation. This is the end of organ dysfunction. Septic shock also causes oliguria and causes an altered mental status. SOFA, or Quick SOFA Score, which is a calculation tool, evaluates for poor outcomes in affected patients based on altered mental status and respiratory rate. Emerging infectious diseases. This incidence in humans has increased in the past 2 decades. It threatens to continue increasing and knows no national boundaries. New infections resulting from changes or evolution of existing organisms continue to occur. Known infections spreading to new geographic areas or populations are also emerging, and previously unrecognized infections are appearing in areas undergoing ecological transformation. Past infections are also re-emerging. This is the result of antimicrobial resistance in known agents or breakdowns in public health measures.